Hello everyone, I am Dr. Niti Raizada. I am the Director of Medical Oncology and Hemato-Oncology at Fortis Cancer Institute at Bengaluru. Today I want to discuss an extremely important topic for all the cancer patients and the survivors, that is COVID vaccination and cancer. Well, we know that most of the age profile of cancer patient would be a higher age group. These subjects might have comorbidities like hypertension, diabetes, or sometimes renal dysfunction or cardiac dysfunction. And therefore, all this can predispose to a higher risk of severe COVID infection if they get at all. Also, what we have to understand is that these are the patients who would have frequent hospital visits, and therefore the outdoor exposure will be much higher. So all these patients need to prioritize COVID vaccination. Not just the patient, but also the caregivers, the household members, and the primary contact of the patient requires vaccination. One simple word is that COVID vaccination is by and large safe for all such patients. What can we do in individual subset is what I want to discuss. So, talking about individual subset, the patients on active treatment. First subset is the patient who are on chemotherapy or immunotherapy. Now, all patients with chemotherapy are suitable for vaccination, but normally what is advised is that they should not have low WBC count or low platelet count during that time. A gap of 6 to 7 days is generally advocated. It might be useful to do a CBC, that is complete blood picture, before doing vaccination. The second subset is a patient who will possibly undergo surgery. Well, talk to your doctor to figure out whether you can take vaccination now or later on. The third subset of patients is who are on radiation. Most of the time, if they are only on radiation, they would be possibly suitable for taking vaccination. The fourth subset is a patient who has had acute leukemia, which is recently diagnosed and is in the first month of therapy. This therapy is known as induction therapy, and COVID vaccination during active induction phase is not recommended. You may be suitable at a later date. Any patient with chronic leukemia can take COVID vaccination. The next subset is stem cell therapy or bone marrow transplant. In patients with autologous bone marrow transplant, allogenic bone marrow transplant, or CAR T cells, which is not available at this juncture in our country, in all the three subsets, talk to your doctor. Normally, in the first 3 months, they may not advocate it. However, if a patient has acute graft versus host disease, this is definitely not recommended and may be recommended eventually. The next subset of patients is who have had breast cancer or who currently are taking treatment for breast cancer. It is recommended that the vaccination should be given in opposite arm so that there is no confusion once there are small swollen lymph nodes which could happen after giving vaccination. Mammography and ultrasound of the breast could be avoided, especially when the patient has just taken a COVID vaccination and is due for booster dose. Most of the advanced malignancy could have patients on clinical trials. Now, in clinical trial setting, it is recommended and highly encouraged to give vaccination, and it might be useful to inform the sponsors or the sponsors who are actually recording each and every situation in which these patients are monitored. So, by and large, most of the time you would want to consult your oncologist, but it would be safe to take vaccination. The main question remains is whether COVID vaccination is actually useful in cancer situation. Most of the time we feel it is useful. However, we have yet to have wider results or wider data to substantiate the same. The usual question which we would always have is which vaccination? Well, in the United States or in Europe, you may possibly speak about Pfizer or Moderna, but in our country we just have two options. It is by and large advised to take any vaccination which is available. There is also a discussion in oncology patients whether we can give shorter dose of booster. So whether we can give the second dose within 21 days of the first. But at this juncture, the recommendation is between 4 and 8 weeks, depending on the vaccination you take. Whether it is Covishield or Covaxin, you could probably go ahead based on what is available. And there's again discussion whether we can take the booster dose of another vaccination at a later date when there's more data to say that they work on different strains. So in summary, prioritize vaccination for cancer patients, cancer caregiver, and of course for all cancer survivors. Thank you.